How to change a surgical dressing at home. After any surgical procedure, there is always a wound to take care of after you have been discharged from the medical facility. A wound dressing is placed over the surgical incision to block away dirt, dust, or microbial invasion, so it must be kept clean, dry, and away from any possible contaminating agents. When you are at home, you can change the surgical dressing on your own if you're sure you know how to. The wound must be easily accessible. If not, you will need someone else to help you change your wound dressing. Changing wound dressings is not complicated. You just need to wash your hands, be in a clean environment, and use sterile products. Try to obtain the following items before getting back home in order to minimize the stress from not having the appropriate supplies. Sterile gauze pads, sterile gloves, cotton tip applicators. You need to use them with some saline solution in case the dressing sticks to the surgical wound. Surgical adhesive tape, properly sized surgical bandages and dressings. Steps to change your dressing. You will need to remove the dressing you have on, but first, wash and clean your hands thoroughly with water, antibacterial soap, a hand sanitizer, or alcohol wipes. Dry your hands completely with a clean towel or gauze. Put on medical gloves before touching the surgical dressings and the incision area. Place all of the supplies you will need at a nearby table or on your bed to have them all handy. Now, gently remove the dressing you have on, carefully detaching the tape from your skin. Discharge the old surgical dressing and take off the gloves. Put new gloves on and clean the incision wound area using a sterile gauze soaked with some saline solution. Use another gauze pad to completely dry the wound and surrounding surface. Place a new dressing over the surgical incision. You should avoid alcohol or harsh soaps that can damage the skin. Check with your doctor for approval of certain soaps. Do not use lotions, talc powder, or creams in the incision area. Remember, always follow your doctor's instructions. The surgical dressing usually needs to be changed for the first time 24 hours after being discharged.